Hello, everyone. How's everyone doing? Look good. Excellent. So, who's ready to learn how to have a clear, focused, and supercharged brain? Hey, how about doubling their energy? Right? How about learning strategic nutritional strategies to prevent diseases such as like Alzheimer's? All right. Well, the speaker tonight is none other than Dr. David Yachter. You know him, you love him. Now, Dr. Yachter, he's a 1993 graduate from Life University, okay? He graduated with his Doctor of Chiropractic degree, and he's been a practicing physician for the past 22 years, okay? He's also a formerly trained endurance athlete, and he's brought that passion for healthy living all over the world. He spearheaded mission trips to places like Panama and even Jamaica. Of course, you know that's the best place. Okay, but he's been Chiropractor of the Year in 2006, 2007. He's also received the BJ Palmer Life Service Award. Okay, now his greatest accomplishment is this young man there in the center, Josh. That's one of his 3 sons, and he's also married to Yvette Yachter. Now, everyone, please get up and help me introduce Dr. David Yachter.
I already got the crowd picked out now. I got the super energized ones right here. They're leading the charge. Thank you for your participation. All right. I'm Dr. Yachter. If we haven't met, I want to welcome everybody here. Raise your hand if this is your first workshop ever in our office. All right, everybody give them a round of applause. Awesome. How many of you guys have been to 3 or more workshops? Everybody put your hands up. Good. Keep your hands up if you've been there 5 or more workshops. 10 or more. 20 or more. 30 or more. 40 or more. 50 or more. Turn around, hands are still up. So, all right, we'll leave it at that. This is, I guess you can call it a workshop culture. It's kind of like a Pringles potato chip. Once you eat one, you just can't stop. The Lay's potato chip. All right, I see some brand loyalty here. Yeah. That's good. I know we're, okay. So we say here at Elevation Health, when you stop learning, you stop growing, and when you stop growing, you start dying. So we always do the workshops every month, and my wish and my prayer is that, we don't let you leave the same person that you walked in with. We want to fill you up, give you some insights, some resources, some valuable tools to really make a better life and a better future for you guys. How many of you guys would like this year to be your healthiest year ever? Yes, good. Well, you're in the right place. So I want to dig right into it and kind of show you what's coming down the pike here. We've got next month our Heart Smart Nutrition Workshop. September is National Heart Health Awareness Month. And as you know, or may not know, 1 out of 2 people in this country every year die from heart disease. So it's, the blood pressure, the cholesterol, strokes, all of that needs to be addressed. And as a community service, we always do this. We do it here. We even offer the program at places of work and worship. We donate our time in the community. So if you don't have a speaker out in your region at maybe your workplace or whatnot, we do offer programs in the community. But we will be hosting it here also Thursday, September 10th, Heart Smart Nutrition. So please put it in your calendar. The other thing that we have is these workshop cards. So if you haven't seen them yet, we should have some at the front desk, and it's got basically the title for every month for the rest of the year. And you can keep track with that as well. Going right into our topic tonight, where we're going to learn about brain health. How many of you guys want your brain to work a little bit more clear, focused, supercharged? Yes. Myself included. We're going to show you some of the things that you can do, some tips and tricks, but we're also going to show you some of the what not to do's. And this may go against a little bit in terms of the grain, but please let it be known that anything that I'm going to recommend to you doesn't just come shooting from the hip. It's going to be supported by medical research, fact, and things that come out of medical journals. So you guys will see for yourself Some of it's going to shock you. It's going to say, well, why did my doctor recommend this if what you're saying is true? Again, don't take my word for it. I'll give you the references, and then if you need any other direction, I can help you with that. But again, you know, the purpose of why we're doing this tonight is, obviously, if things were going well, you probably wouldn't be here. If you felt like you needed help to do a little bit better, and you have to really peel back the layers and see what we can do. And sometimes that means clarifying some conflicts that we have, whether it be with some of the information that we've been taught in the past. But you know, nothing ever stays the same, right or right? Nothing ever stays the same. Bert, I got one right up here for you, right here, buddy. All right. So that means that throw you out there, but okay. I love Bert. He's a good man. So SAD state of affairs means the standard American diet, and the standard American diet is the acronym for SAD because a lot of that is really what's causing a lot of problems with our brain disorders, brain disease. When I say brain disease, it's almost tongue-in-cheek because there really is no such thing provable in terms of objective evidence as a brain disease. When you say somebody's bipolar disorder, depressed, ADD, things like that, there really is no objective test. So most of it is subjective, meaning you know what the actual physician actually sees. So with that being said, as we start to unravel a lot of these things, you'll see what I mean. Depression. 6 out of the top 10 selling drugs today are for depression. It's pretty insane when you stop to think about it. And you know, 20, 25, 30 years ago, how many people did you know on antidepressants? How many commercials did you see on TV, people floating, skipping through fields of wheat, you know, smiling because now they have their antidepressant? You know, there's you know, experts talk about that. It's called disease mongering. And you know, when they hawk prescriptions to you and things like that, which they don't do in any other country, it's really only in the United States and Australia. It's really the only two places that are legal in the world where drug companies can actually influence you to go to your doctor and where you demand to take a prescription. And in doing so, in a lot of ways, they actually make patients out of perfectly healthy people. Describing these symptoms, you're like, oh yeah, I have that. Fidgetiness, I can't sit still. You know, yeah, maybe I have ADD. You know, my child can't sit still. Oh, maybe he has ADD. You know, I'm depressed. I don't have a lot of energy. Do you have depressive symptoms? Yeah. Well, yeah, I have that. So you go to your doctor and you demand that. And it puts a lot of people on these medications, some of them which may not necessarily need to be on them if they knew really what normal is. Do we not all have challenges in life, first of all? And second of all, well, maybe some of the stuff that you're eating is ruining your chemistry, not allowing you to have the proper neurotransmitters and normal brain function. Every 70 seconds, Alzheimer's disease is diagnosed. Every 70 seconds, over 1,200 people a day. If you're 65 years old, you have a 1 out of 10 chance. If you're 85 years old or over, it's 1 out of 2. Just imagine the impact to the budget that we're going to be dealing with literally 30, 40, 50 years from now. There will be trillions of dollars needed to treat this. And it's a serious thing, and it's getting worse. It's the 5th leading cause of death for ages 65 and older. And now what they're linking it to, which you're going to learn tonight, is high carbohydrate intake. Now they take diabetes and obesity, and now they call it diabetes. Or you may have heard of Alzheimer's or dementia now, or precognitive decline being referred to as type 3 diabetes. Because now when your brain starts to not function properly, that is the onset of that. And again, it's brought on by high insulin levels, which are driven by what? Carbohydrates. So those are statistics. Then we have things like autism, 1 in 10,000 births to 1 in 166 births. Actually, I think the statistics are lower now. Last time I saw it was 1 in 85. And then we have attention deficit disorder. All these things are just getting worse and worse. And tonight we're going to dive into the reasons why. Okay, so when we talk about a healthy brain, there's a couple of different ways to break it down. From a standpoint of preeminence, over the overarching parts of this that we're going to break down really come down to 3 things. First of all, your immune system, which launches something called cytokines, which you're going to learn about, which are hormones which drive inflammation. How many of you guys have heard of inflammation? Okay, so you guys know that? Now here's the thing. There's there's two types of inflammation. You know, one is good, one's not so good. So, you know, like if you get a mosquito bite or a bee stings you, that's what? Inflammation. Things start swelling, itching, red. We've all had that, we've all felt it, it's not very fun. But then we have other types of inflammation, like if your brain is inflamed and some of the internal organs, like the arteries of your heart, become inflamed, the inner lining. Do you feel that? Not necessarily. And then what happens if it gets so severe, you have a heart attack. So you don't feel that, but then the end result is, you know, crisis. So when your brain is inflamed and your organs are inflamed, you don't feel that inflammation. It's not like a bee sting. And it's very serious and very dangerous. So we're going to talk about that, what causes that, endocrine, which is your hormones, by the way, much of which is controlled in the brain, pituitary and the hypothalamus, which if you're on the Nutrimost program, you know that we're working with that to reset your metabolism. So we're going to talk a lot about that and how it affects your weight. And your nerve system, which is neurotransmitters, the happy hormones like serotonin, dopamine. We're going to talk about all that because that is going to determine whether you're enjoying life or not. And a lot of that has to do with brain health, and so we're going to cut into that as well. So first and foremost, starting with the immune system and inflammation, let's talk about cytokines. What are generally cytokines? Generally, more than anything, comes from fat. So when you have a lot of adipose fat in your body, hips, thighs, waist, especially your belly, and this type of fat is a hormonal system in and of itself. And that hormonal system, that fat, that adipose tissue, generates the most pro-inflammatory compounds known as cytokines. And that inflammation, like we said, is a silent killer. It's in your brain, it's in your heart. It causes diabetes, Alzheimer's, cancer, arthritis, autoimmune diseases. I mean, inflammation really, truly is at the heart. It's at the root of every degenerative disease today that people are medicated for and succumb to early in life. So all of this can be controlled, reversed, and healed up to a good degree. So especially belly fat, as we said, significantly raises your risk for heart disease, cancer, diabetes, and dementia. That's why we have so many people that come to our office for the Nutrimost program, because the technology that we have actually allows us to literally target the belly fat. And when we do that, we use the technology. In doing so, we use the technology that allows us to balance out the hormones and the neurotransmitters. And that's what allows us to make those changes, very specific to this type of issue right here. So, second thing that I mentioned is the endocrine system, the hormonal system. And I want to talk about that because that's going to come in a few different varieties here. First thing is insulin. You guys know what insulin is, right? Okay, is insulin a hormone? Yeah. Does insulin have to do with fat burning? Yeah, you know that, yeah. So we know that it has to do with fat burning. You know that it has to do with controlling your weight. Many of you, we've worked with that, showing you why we think it's really a good idea. It's very, very beneficial, not just to lose weight, but really to do this for the rest of your life, to eat proteins, fruits, and vegetables. That strategy in and of itself is an anti-inflammatory strategy. And so when we do that, we're actually controlling insulin. When we're not aware of this and we're eating things like grains, gluten, rice, bread, pasta, potatoes, and all the stuff, all the starchy stuff that we love, the bread basket, all the stuff that we love. Then what we're doing is we're allowing insulin to respond and elevate. And when that happens, then we have a hormonal response, which is going to trigger inflammation. And all the Alzheimer's journals, all the medical journals now are showing that people with elevated insulin levels have the highest risk for Alzheimer's disease. So how many of you guys are aware of that? Okay, so this is really important. Too much or too little thyroid hormone. Okay, another endocrine problem. What can mess up your thyroid? One thing and one thing particular, which is rampant today, toxins. Toxins. Toxins have an affinity for the thyroid in women. There's a greater chance that you're going to have thyroid problems than men. One out of 5 women, 1 out of 10 men. Then we have too much and too little sex hormone, like estrogen and testosterone. What can influence that? Well, prescription drugs we're going to talk about tonight, namely cholesterol, which has to do with making these hormones. And so some of these prescription medications that you may or may not be taking may be affecting this and affecting your brain in the process. And I'm going to show you exactly where the connection is. How about stress? Can that affect the sex hormone levels? Lack of sleep. I see some of you guys yawning right now, namely my son. Guess he's heard enough of me for a while. And rest. So these are all things that, you know, we have, they affect our hormones, and it causes damage to the brain. And again, I'm going to make the connection for all this to you tonight. So incidentally, insulin, when you have too much sugar, you have insulin resistance. Insulin resistance leads to diabetes, right? Did you see that? Why break it down to 2 words? It's really the same condition. But the connection that I want you guys to see right here is it's not just diabetes. Like when you have diabetes, you're already on your way to cognitive decline. You're already there. If you're diabetic, if you're pre-diabetic, you're on your way to diabetes. If you have diabetes, you're already on your way to Alzheimer's. All the medical journals are showing that right now. Increased insulin levels equals fat storage. So that means, you know, you're either burning fat or you're storing fat. How many of you guys would rather be a fat burning machine? Okay, so anytime you eat food that drives insulin, that hormone is being released and you're programming your body to store fat. So anytime insulin goes up, you're increasing fat storage, and then you're also increasing insulin levels, because insulin and leptin pretty much track the same. And they both are hormones that determine whether or not you're storing fat or burning it. So these are the things. The Journal of Alzheimer's Disease a couple of years ago said carbs might be linked to buildup of toxic proteins in the brain. And memory function is directly affected by what? Blood sugar. Neurology Journal. So this stuff has actually been out for a while, and everybody's starting to get caught up with it, but not fast enough. So thyroid hormone, 1 out of 5 women have a thyroid condition, 1 out of 10 men. Thyroid controls your what? Your metabolism. So, you know, if you've got your hormones, neurotransmitters out of balance, this is the first thing that goes down. It affects your hypothalamus, and your thyroid starts to go downward. We typically see that when we do a body composition analysis. We'll see the metabolic age several years higher or decades higher than a person's chronological age. And what controls that is the hormones and the neurotransmitters. The thyroid is ultimately involved with that, and so if your body is toxic, it attacks the thyroid. Where do we know toxins come from? We're going to get into this: mercury, lead, mold. Where do we get mercury from? Amalgam fillings. How many of you guys ever had your teeth filled? Yes. Chances are, what's in there? Yes. Lead, amalgam, yeah, mercury. So we put in compliments of Jim, thank you Jim Hamilton, in your handout. You have a little thing there about how the American Dental Association has known about the risks. I mean, it's a deadly substance. They've known about it for a long time, and the FDA's been made aware of it. But you see how the politics works, and it's still out there. And most of the dentists are still doing it. Not something you want in your body, in your mouth, in your brain. And it doesn't take a lot. I mean, if you have 1 amalgam filling, if you're chewing gum, or you have hot liquids like coffee or tea, you're literally vaporizing the mercury out of those fillings, and it goes into your brain. So these are big problems. Lead, mold, chlorine. Not only does it come from amalgam fillings, but and of course insomnia, memory loss, Alzheimer's. All of these symptoms are related to these toxins, especially mercury with ADD and autism. There's linkage there, of course, you know, from vaccines. They put mercury in pretty much all the vaccines. When they say mercury-free vaccines, if you don't check the box that it came from, if the physician tells you there's no mercury in it, then what I always recommend is that you ask them to bring the box that they take the vaccine from. And more often than not, when I've had patients do that, you do see the thimerosal in it. You do see the mercury. So, you know, again, these are things that I personally don't do. I don't do it for my children. I don't do it for myself. I don't recommend them. I know some of you may have jobs where they actually require you to do that, unless there's a way that you can get, you know, some sort of omission. But these are things that are very serious and very dangerous, poisonous, and in some cases deadly. And of course, it poisons your brain. Once it gets in you, it does not come out unless you do very stringent and specific strategic steps to take it out. And in many cases, it takes years to get it all out. In fact, if you have amalgam fillings, you must use a special mercury-free dentist, because if they just rip them out of your mouth, it'll make you worse than if you didn't do anything at all. You have to have a special dentist who knows how to do that whole thing. And my wife had it done. Mary, where are you, Mary? Aren't you? You had it done, didn't you? Yeah, so we've got it. You did too? Okay. So Michelle, a couple of you guys had it done, so you know. Otherwise, you'll feel like if you have a dentist that does that to you and they don't go through the protocol, you could be walking around with bricks in your shoes for like a month. And it's horrible. It's horrible. So it attacks your thyroid and your brain, and you know, it's in every shot that we ever got as a kid, and sometimes if we get flu shots. So let's talk about the reproductive hormones, estrogen and testosterone. So with an estrogen imbalance, we have hot flashes, PMS, hair loss, reproductive organ cancer, anxiety. Okay, not exactly happy brain health. Testosterone imbalance, impotence, cancer, memory issues. If you have low testosterone, did you know that? Yep. And imbalance is caused by high cortisol levels, so that's what's going to throw everything off. Stress, insomnia, toxins, sugar, bad fats, prescription meds. Prescription meds? Really? Well, we'll have to look into that, and you'll see exactly why. And an acid diet and lifestyle. All right, so with the cellular communication, from the neurotransmitter perspective, how many of you guys have heard of serotonin and dopamine? We've all heard of those. I like my little pictures. You see the happy picture right there for the serotonin? And the dopamine helps give you attention and focus. You see the little smart child there doing this thing? And for memory and focus, acetylcholine. So who has a good memory? The elephant, right? The elephant never forgets anything. And then the GABA is for relaxation. Now again, these neurotransmitters have to be working right in order for you to have the capacity for the function in your body to work at all those different levels. If there's a mineral deficiency, a vitamin deficiency, if there are problems with your gut, if there's interference in your nervous system, there's a number of different things that could cause breakdown in communication with this, and I'm going to talk to you about that, and that can affect your brain health. Obviously, you guys should know this. The symptoms of interrupting with serotonin, depression, dopamine this is what causes autism, ADD, behavioral disorders. Alzheimer's disease is a deficiency of acetylcholine, and GABA, anxiety, insomnia, and Valium is one of the things that they use to address that. So that should pretty much make sense to everybody. Yes or yes? Okay. So just as a refresher, knowing why we're going to reconnect with that. So I want to talk to you about vertebral subluxation because this disrupts neurotransmitters. How many of you guys have heard of subluxation before? Raise your hand. Okay. Very simply, it's a bone out of alignment, maybe several bones out of alignment, which are no longer protecting the spinal cord and the nerves anymore. They're sitting in a position which actually irritates it and interferes with it. The transmission of the nerve supply is what actually controls everything. It controls your neurotransmitters, your cells, in turn your organs, in turn controlling your hormones, and every aspect and every function in your body. So what your spine is either in alignment or out of alignment. If it's out of alignment, there's going to be detrimental effects, physically and emotionally. And so I would assume that most of you guys have seen this chart before, right? You've seen it in your medical doctor's office, maybe you saw it in our office. It comes from Gray's Anatomy. It's a standard chart which shows you the anatomical or autonomic nerve system. It shows you that basically you have a spine and then you have the nerves that branch off and they go to all the organs. And all the organs are really connected to the nerves and they're controlled by the nerves. So the point that I like to make is this, by the way. That a dead person has all these organs and a dead person has the spinal cord and all the nerves, and a dead person actually has a back also, right, of bones. So you can take somebody who died an hour ago and you'll find the same components in them as you and I. And what does a dead person not have that you and I have? What is it? Life. What is it? Life. So what is life? Life is what utilizes your nervous system as a conduit so that you can express yourself as a human being. So life expression is what flows through there. Life expression, basically, you went from a sperm and an egg in conception when God breathed life into you as a living being. That same intelligence that created the living universe was placed in you, was breathed in you. And then from the sperm and the egg, the cells multiply, divide, until 280 days later, You came out with a gastrointestinal system, a digestive system, a cardiovascular system, a skeletal system, whatever. You came out with a nervous system, a cardiovascular system, all these systems. But out of the 9 systems that your body created, there's only one system encased in bone. And what is that? Your nervous system. Why is that? Because that innate, inborn wisdom is the most important thing in your body, as it intelligently communicates and coordinates all the function of all of the chemistry in your body. All the organs harmonizing, coordinating, working together without you having to educatedly think about that. Does that make sense? Yeah. So the innate intelligence in your body preeminently is the most important thing. That's why your nervous system is the only system encased in bone. Now, it's either protecting that or it's interfering with it. And if it's interfering with the expression and the communication of that innate intelligence, does it not make sense that that person's going to be in a world of trouble with their health? Yes? So that is why we look at the nerve system as chiropractors, almost as an electrician would go into your house and check the circuit breaker to make sure all the power is coming on. No different, same exact thing. There's a universal intelligence in all matter, not some matter, all matter. And it continuously gives to it all of its properties and actions, thus maintaining it in existence and giving this intelligence its expression. That innate intelligence is the most important thing in your body because it controls what? Everything. Yes. So we have to make sure, number one, that your nervous system has no interference. If it does have interference and the spine shifts at a normal position, do you necessarily feel that when that happens? And the answer is no. In the beginning stages, it's like a cavity. It's like cancer. You don't feel it. Most of these nerves that exit between the bones of your back are not pain sensitive. So you could be losing vital nerve supply, or innate intelligence maybe is not communicating in a clear, coordinated fashion. Maybe it's distorted. And the messages, wherever those nerves are going to, do not get there properly or clearly. So they're, instead of coordination, there's incoordination. Instead of function, there's dysfunction. Wherever those nerves are shut down, let's say they're going to your reproductive organs, and that's what's regulating your testosterone and estrogen. If you've got nerves that are nerve supply shutting down there, could that create a deficiency or a hormonal imbalance if you've got this going on? Yes. Now they could treat you with hormones and drugs, but if that's the cause, what needs to be fixed? Same thing if it's right here and that's going to your pancreas. Could that disrupt the normal regulation of your blood sugar? Yes. Could that be a contributing factor to a brain problem or brain disease if that thing sits rotting in your spine for 10, 20, or 30 years? Yes. But there's a lot of different causes for insulin resistance. I'm not saying this is the only cause or always the cause, but is it a causative factor? Yes. You can never have one with the other. If you've got insulin resistance or diabetes, almost a guarantee that you have subluxation. The Windsor study autopsies that were done in 1920 in Dresden, Germany found that. And they autopsied all these people that died from different diseases. There was almost a 100% correlation with subluxation in the part of the spine for the disease that they died from. Did you know that? No. Guys, this research has been out for decades, almost 100 years. And it's true. So we have to look at all the different parts of the spine. Your thyroid, if you have nerve supply that's interrupted, it can reproduce all of these symptoms that we're thinking could be caused by something else. And we could be going to the doctor and getting drugs for all these things and have absolutely no idea. So regardless of what the symptoms are, would not a person be better off without pressure on their nerve system? Yeah. So symptoms or no symptoms, just like a dentist would check you before you have cavities, wouldn't it just make sense from a spinal hygiene point of view that you should probably have your spine and nervous system checked every once in a blue moon so that you know that your body's functioning at its optimal potential? Doesn't that just make sense? Yeah, so I mean, if we had chiropractors, more chiropractors going into elementary schools and teaching our kids about that, we would have a great program, just like the dentist went into the schools. I always say that, guys. People always ask me, it makes so much sense. How come nobody ever told me that? My apologies. My profession could have done a better job. But it is what it is. And if you wait till you're 50, 60 years old to your first spinal checkup, we'll never get you back to 100%. But you know what? You do the best with what you've got. Wherever you're at, raise your hand if you want to make sure that you're 100% of your God-given potential right now. All of us, yes. Which is absolutely impossible if your nerve system is compromised, since that's the one thing that's running everything. Now, I want to share with you something, especially for you chiropractic patients. which is really, really important. When you see us checking how many of you guys remember us checking your legs?
Yeah.
Right, to see if they're even, uneven. We're not looking for, the leg that's short because the bone is shorter. We're looking for something different. Right up here under your brainstem, we want to make sure that your skull is sitting on your spine properly. When you have subluxation of the atlas vertebrae, now they call it atlas because like Atlas in Greek mythology held up the world. When you have an atlas subluxation, that thing just rides up under your skull there. There's no disc above atlas or below it. It's held together only by ligaments. So that bone rides up under your skull, may cause your head to tilt like this. Maybe your shoulder goes up. We could tell usually by a posture evaluation. But what happens is that one bone right there has little holes on the side of the bone. Through that little hole goes the vertebral artery. The vertebrobasal artery goes into your brain and feeds your brain with blood supply. Could that maybe be an important thing? Yeah. So if you're subluxated, you are way out of balance, literally. If any of you guys have felt dizzy or you wake up in the morning, you're kind of woozy on your feet, it very well may be this. Because you're basically, you're throwing off your balance, you're throwing off the blood supply. It can affect the blood pressure. It can affect your mood. It can affect your energy. Which functions in your brain depend on proper blood supply? All of them? Yes. Good guess. So it's called atlas displacement complex. There are some chiropractors that adjust this one bone and nothing else. Because look at all the symptoms that could be related to it. Headaches, migraines, fibromyalgia, ADHD, ear pain, neck pain, back pain, high blood pressure, leg pain, numbness, TMJ, facial pain, disc herniation, spinal stenosis, and degeneration. It can cause your whole spine to crumble underneath you if the most important part is not balanced. Neurologically, guys, this is Houston control. It's your brainstem. It controls your blood pressure, your breathing, your immune system, your sleep, your digestion, and neurotransmitter communication as well. So does that have to do with brain health? In a lot of ways. So what this shows you is what happens when your skull is jacked up on one side because that atlas bone is not seated properly. That's what causes the short leg. When somebody has a stroke, it affects one side of their brain. The one side of the brain that's affected, which side of the body goes out? Opposite side. And that's what we always see. So when we come up and we push in on that, it's called the challenge. We're fooling your body into thinking that it just got adjusted. And what happens? Your legs balance out because the muscles relax. All on one side of your body, the muscles will contract. Your leg, your thigh, your hip, your arm, your shoulder, everything. But if we hit the right button, everything relaxes, your legs balance out. And what do we say? The power's on. Turn to your neighbor, say the power's on. That's it. All right, so now you know what to look forward to your next adjustment if you're under care or the next time you get a scan. Guess if you have never had your spine and nerve system checked or you haven't had it in a while, this is what we use. We use thermography just as a screening. It's non-invasive. We roll it up the surface of your spine. And when we see the colors like the orange, the red, the deep dark red colors, we know those are areas of imbalance. And that's part of the exam. We check posture, palpation. If you've never had this done, obviously it's something that you want to consider strongly. We'll give you an opportunity at the end of the event tonight. If you go up to the front desk, they'll give you a coupon for a discounted exam. I think it's like $40 or something like that. So they'll give you a coupon for that. If you'd like to do that, we'll be happy to set an appointment for you. And so, with that being said, I'm moving along at a good pace. I'm going to have my dynamic staff come on up here to help me recognize just a couple people. So, Mary, you're not my staff. Well, no, I'm a slow learner. Okay, so, we just like to recognize a couple of folks who really help us help them. And one of the things that we love is to see people get great results. We really celebrate, backstage. You guys don't see it, but we really get excited when we see great X-ray changes and plus we see people do really well. And so we just want to recognize a couple of folks who've been really on track, like spot on with their adjusting schedule, not missing any appointments. And if they do miss an appointment, they just rush to the phone, call them, and then at least they get to go home real early with their family. So they really love it too. So when we call your name, please stand up, and we just want to recognize you for all your hard work and dedication. Donna Anderson, if you can, please stand up. Everybody give her a round of applause. Andre, Eugen, Andre, stand up, Andre. Nadine Miller. I see you there, Nadine. We're coming around. Tish Berger. Tish. And Sarah Hawk. Come on down. Where's Sarah? We got one for Sarah here? Maurice. He's on island time. Yeah! Give him a big round. Okay. So, what I want to do, we always do this just to give yourself a mental break, and because the mind can only endure what the sea can endure. And so mine can only absorb what the sea can endure. So I want you guys to come stand up and face to the right. Put your hands on the shoulders of the neighbor to your right. And I want you to squeeze their shoulders and get that stress out. Squeeze. Not too hard. Squeeze. Get that stress out. Yeah. All right. Karate chop. Good job. Karate chiropractic. Awesome. All right, turn around and love your other neighbor. Turn the favor. Lots of love. Get that stress out. Awesome. All right, karate chop. Nice. You guys are doing great. Give yourself a round of applause. All right. Got some shirts, heads up. Watch out, don't get hit in the head. Give it to me. You earned it. I am losing my touch. That works. Woo! All right, now, how do you guys like the massage? Is that good? Okay, we've got some free massages at the end of the program tonight. And, you know, just if you haven't figured this out yet, they're always usually in the first, front rows so that we have maximum participation. But if you lean under your chair and you find yourself a ticket that's for a free massage, you may see it hanging down there. If you have one, it looks like this. That's your picture right there. We got your picture on there. So, Joe, can you raise your hand? Turn around and see Joe. You're going to see Joe at the end of the show. And it's the other way around. If you get one, you get to massage Joe. Joe is our massage therapist. He's awesome. Everybody who has ever had a massage from him loves him. He does great work. Phenomenal knowledge about the muscles and the biomechanics. And he's been a patient long before he even went to massage therapy school. So I have the highest trust for him. You guys are in good hands. So go ahead and see him when you're done. It's just whatever. It's a five-minute massage, and you can tell him what he can do to help you. And all right, so let's continue on here. So what do we want to do to start balancing out for brain function? Let's make some practical application here. We talked about some of the problems. Now we want to talk about some of the solutions. We want to reduce and eliminate sugar, toxins, and bad fat. Why is that important? What do all these things do? Sugar, toxins, and bad fat. They all have one thing in common. They trigger inflammation. Very good. They trigger inflammation. Turn to your neighbor and say, inflammation. Inflammation. Sugar causes inflammation. Does it cause your blood sugar to go up? Yeah. Does it cause your body to store fat? Yeah. But it drives inflammation. And inflammation, remember, is at the root cause of every degenerative illness that we're talking about today. Toxins do the same exact thing. Toxins, when they go into your body, they're man-made. So they're not naturally existing in nature. They go into your body. They don't have receptors on the surface of the cell, so they just hang out there and wreak havoc at the level of the cellular membrane and cause inflammation. Same as sugar. And the same thing as bad fats. Bad fats are kind of like toxins from the standpoint that they're man-made. So your body cannot identify them, trans fats and all the bad fats. Now, the problem with the situation that most folks are in when they have heart disease or Alzheimer's or diabetes is that for decades we've been having the low-fat diet. And, you know, I thought that was a good idea also. The problem is that it deprived our brain of the necessary fuel to make new healthy cells. So there's a difference between bad fats and good fats. The trans fats are the bad fats. The good fats are going to be the things that you want to start loading up on now. And you will have my permission to load up with butter, coconut oil, steak, porterhouse, ribeye, yeah, and put lots of butter on top of it. Whereas before you wouldn't think of doing that without a cardiologist standing next to you. You can do that, and you should have been doing that. And all the studies that historically go back that started in the late 1940s indicated that, and it was all shoved under the rug. And because of that, because we didn't have the good fats that we needed, we started developing the clogging of the arteries, the heart disease, and the Alzheimer's disease, and all these inflammatory conditions because we didn't have those good fats in there. To make a bad thing worse, they told us to have the bad fats because they were low in fat. The trans fats, the margarine, low in fat. But because they're trans fats, they're even worse than bad fats. So they all interfere with the normal communication of hormones and neurotransmitters for proper brain function. So, you know, when you look at this slide, look at all the different things. You know, for example, Mom, the Quaker, why don't you take that out of your purse so I can show everyone?
I threw it away for her.
Oh, thank you. Okay. So that's my mom. Everybody give her. So, you know, she has it. She doesn't eat that stuff. She gives it to everybody else. I'm like, why are you doing that? You're poisoning people. It's not good. So you see those Quaker chewy granola bars, and we were sitting in my office. I'm like, do you know what this has in it? It's like half of it is sugar. You look at glycerin and propylene glycol and all like sugar and corn syrup and more corn syrup, and it's like you go through this whole thing and like, I thought this Quaker guy was a good sign. No, it's not. So loaded with trans fats and sugars. You've got to read these labels. It doesn't matter what the box looks like, how savvy that commercial is. It is not good for you unless you read that label and you've scoured through that. A lot of it is laced into things like tomato ketchup. We would think, oh, tomatoes, vitamin C, it's got to be healthy. High fructose corn syrup. Unless it says no high fructose corn syrup, that's what you're having. And all these cereals, of course, the sodas. Here's what's worse: if you have Diet Coke, and you have artificial sweeteners like aspartame or sucralose or sweet and low. That's worse than the white stuff, because what they do is they disrupt. They literally target your neurotransmitters and your hormones. Forget about the sugar going up, causing you to become fat or pre-diabetic. Immediate dysfunction, hormonal and neurotransmitter disruption, which slows your metabolism. Now, instead of having a normal 50-year-old metabolism, your metabolism is working like somebody who's 85 or 90. The more that you use those artificial sweeteners, that's what that does. So better you have the bad stuff than the cancer-causing artificial stuff. But you know, so with all the stuff, and then we look at this right here, the ranch dressing. Well, what's wrong with that? What's in that? Trans fats. Yeah, so you just read the label on that. It's full of all types of words that you can hardly pronounce. And that's a good rule of thumb, by the way. If you can't pronounce it, don't eat it. You know, if it was made in a laboratory and you can't pronounce it and it looks like a biochemistry exam, probably not a good idea. You know, if God didn't make it, it don't belong in His body. So pretty simple rule. And so when you're sitting down for a beautiful salad, you know, with chicken and radishes and tomatoes and avocados, and you have a beautiful salad there, why would you want to mess it up and put that stuff on there? You do extra virgin olive oil, you know, sliced lemons, limes. You know, if you really want to have a little bit of vinegar, maybe a splash of it. Not too much though, because you don't want to take away the alkalinity of all those greens. when you use the sliced lemons or limes with the olive oil, it keeps it nice and alkaline. And that helps your body repair and regenerate new healthy cells for good brain function. So, you know, aside of the fact that we went over all these, remember I said you double your risk of Alzheimer's when you are a diabetic. So the bad fats, here's how it works. As I was mentioning before, with you have the cell membrane, and the cell membrane is permeable. So you need good stuff going in and the bad stuff going out. The waste has to get out. And that only works when you have a healthy cell with a healthy membrane. And what happens is when you have the trans fats and the sugars and all that stuff, if it causes inflammation of the membrane or the cell wall, it shuts the function of the cell wall down. And now the bad stuff can't get out and the good stuff can't get in. And then we have disruption and distortion of the normal cellular communication, hormones and neurotransmitters, and there goes our brain health. So that's really what this all amounts to, guys. At a cellular level, that's what you're doing. You know, it's hard to resist a lot of these good foods. You have a piece of cake or cookies in front of you, or you have lasagna there. You know, do you really have to have the salad? Can't you just have the hamburger with the bun? It's like, you know, it's not easy. But I will tell you this. When I make decisions to put that stuff in my mouth, you know what I'm anchored to? More than the immediate gratification, which is fleeting and maybe lasts about 15 seconds on the tip of your tongue of how good that feels. Now when you have all that brain chemistry, that does the same thing as when you have cocaine or any other drug. If you're doing that with sugar, it's the same way. It's a quick fix. It's a hit that you're getting from the food. It's like a drug. I'm more connected to how my energy is, how good I feel, you know, how clear my thought is, how focused I am, my quality of life. The fact that I want to be out running my kids. Like we went to Six Flags 4 weeks ago, Josh and my boys and my wife, and we went there 6 years ago, and I could hardly get through the day. When we went this time, we were there till 7 o'clock at night. Woo! We kept going and going and going. And you know what? To me, that's a result of not doing that and doing something else instead. Largely, for the most part, most of the time. Does that mean that I don't, you know, go off the reservation, so to speak, sometimes slack off? I do just like anyone else. Usually Friday night. That's my cheat night. So I'll have peanut butter instead of almond butter. No, I'm just kidding. You know, but even if I have a pizza, it'll be a gluten-free pizza. You know, so there are various ranges. But what I am saying is that the decisions that you make will determine the results you get. And is it really worth just the immediate short-term gratification, sacrificing your body and your brain to the point where sadly you may not know who your spouse or your family members are 20 years from now? You know, I can't bear the thought of that. You know, it's a reality, and I've seen that, and that's not what I want. I want the best quality of life for as long as possible, don't you? So those decisions boil down to that. And on a microscopic level, when you're looking at the cell membrane is made up of fat. So you need those good fats to repair and regenerate that cell wall. Primarily, you need the DHA and the EPA. Phospholipids, protein, cholesterol. You need all of that to repair and regenerate the cells so that you have proper hormonal function, proper neurotransmitter function, proper nervous system function, proper energy levels. I mean, inside these cells, you have a positive charge. Outside the cells, you have a negative charge. The polarity of the cells is going to determine your energy levels. All that is really, really important. So if you're deficient in any of these or taking medications which rob you of your body's ability to absorb and assimilate that, that's going to change your health for the worse. So this is some of the research I was talking about from David Perlmutter, as a neurologist. And he wrote in his book, Grain Brain, he said, statins may lessen brain function and increase your risk for heart disease. Now that's kind of odd because I thought we were supposed to take statins to reduce our risk of heart disease. How about that? So in turn, they're finding it causes the opposite. Cholesterol is a critical brain nutrient. It's a what? Critical. Essential for the function of neurons. Where do you have neurons? You need this. This is what we're talking about tonight. And it's showing us that cholesterol is critical for that. Okay? It plays a fundamental role as a what? Building block of the cell membranes, which means if you are taking cholesterol medication, or you know anyone who is, You're depriving the body of these fundamental building blocks for proper cell function, especially in the brain. It acts as an antioxidant and a precursor to important brain-supporting elements like vitamin D, which is important for what? Hormones, which we talked about, such as what? Testosterone. Okay, so if you're on cholesterol medications, what does that do to your risk of the hormonal imbalance that we just talked about? It increases it significantly. Most importantly, cholesterol is looked upon as an essential fuel for the neurons. Neurons rely on the delivery of what? Neurons rely on cholesterol. Okay? From the bloodstream via specific carrier protein known as what? LDL. Now, what is LDL often referred to as, the good or the bad cholesterol? Wow. But the doctor is saying that the neurons rely on the delivery of cholesterol from that. Whoa, that means that all this while I've been trying to get that as low as possible? Well, if you've been doing that, that may not be the smartest thing to do long term. Here's why. Framingham Heart Study, this was one of the world's, I think the world's largest trial heart study, was started in 1948. Started with like 54 or 5,500 people. And it kept going and going and going, and then they reevaluated a lot of people back in the early 2000s. They found some incredible things. They looked at 789 men and 1,105 women who were part of the original group. All were free of dementia and stroke at the beginning of the study and were followed for 16 to 18 years. Okay, so here's what they found. Cognitive tests performed. All the same measurements that they used for Alzheimer's patients: concentration, concept formation, learning, memory, attention, abstract reasoning, organizational abilities. Here's what they found. The people with the total cholesterol, less than 200, with the lowest cholesterol, performed less well than participants with borderline high cholesterol, okay? And participants with the highest cholesterol. The people with the lowest cholesterol had the poorest test results and scored closer in the range to the Alzheimer's patients than the people with the total highest levels of cholesterol, which studies are indicating clearly across the board. The higher your cholesterol is, the better your brain works, because your brain needs what? Yeah. The lower you push your cholesterol with statin drugs, the closer you're getting to what? There you go. So, that pretty much does. So, did I skip over that last one? No, we did that. We did that, and we did that. Okay. And so, so here's another one. So at Iowa State University, he was a researcher, biophysics. He said, when you deprive cholesterol from the brain, you directly affect the machinery that triggers the release of what? Neurotransmitters. That's the data processing and memory functions, how well you remember things. If you try to lower cholesterol by taking medication, attacking the machinery of the cholesterol synthesis in the liver, the medicine goes to the brain too, and it reduces the synthesis of cholesterol, which is necessary where? In the brain. In the brain. So their studies showed that there's a direct link between cholesterol and the what? Neurotransmitter release. Primarily the serotonin, which is the what? Happy hormone. So that means if you're taking cholesterol medications, deductively speaking, that's probably going to may predispose you to depression. 1993, elderly men with low cholesterol were found to have 300% higher risk of depression in this study than their counterparts with higher cholesterol. In 2000, study in the Netherlands reported that men with long-term low total cholesterol levels experienced more depressive symptoms than those with higher. 2008 reports published in Journal of Clinical Psychiatry, low serum cholesterol may be associated with suicide attempt history. 2009 Journal of Psychiatric Research published a study that followed 4,500 U.S. veterans for 15 years. Depressed men with low total cholesterol levels faced a 7-fold increase of risk of dying. Yeah, I mean, so it's black and white. Why would we want to do that? Well, we're taking the recommendations of basically, what is commonplace today in terms of medical practice. Yeah.
How about when it's really high, like in the 400s?
So the question is, what about if you have really high cholesterol in the 400s? So my question is, does cholesterol actually cause heart disease? Why are we afraid of high cholesterol? Where does that fear come from? because we've been told that high cholesterol causes heart disease, and it turns out that that's really not true. In the New England Journal of Medicine, they published a study many years ago, and they found that high cholesterol levels was not necessarily the imminent factor determining whether or not that person was at risk for the heart attack. It was not that. It was the inflammation markers. The HSCRP markers in the blood work, which denotes inflammation. So people who have a 300 or a 400 level cholesterol at that level, if they have no inflammation at their body, they're not the type of people that are going to get heart attacks. It's the inflammation which causes oxidation of the cholesterol, which causes the risk of the hardening of the arteries or their atherosclerosis. But if you have an anti-inflammatory nutrition and food plan, then you are not at risk for that. If your body is making a lot of cholesterol, and the cholesterol is a necessary ingredient to rebuild and repair and regenerate new healthy cells, what does that tell you that that person's body is trying to do? Heal. Why do you want to interfere with something that your body knows that it needs more than you or your doctor? It does make sense, doesn't it? Somehow you have to, maybe you want to trust the wisdom that actually, if your body was smart enough to make itself, then maybe it's smart enough to heal itself. So that's why the more you understand about this, the more of these questions that you ask. Now, so here, I'm not telling you to stop taking your cholesterol drugs. What I am telling you is this. If you don't like the way this sounds, you make that decision. Okay? You go back to your doctor and say, hey, I don't understand this. Here's the research. I read the book. Here, go get Grain Brain. That's like the guy's a neurologist. All the research is in there. And say, this is true. These are in the medical journals. Why is it that we're still doing this? There's no risk. There is no risk. Me, personally, myself, nobody in my family would I ever imagine that being the case. I would never do that. But again, I'm telling you guys, I'm giving you the information, and I want you to be comfortable with the decisions that you make. I don't want you to feel like, I'm putting you in an uncomfortable position, but to me, this is insanity, honestly. It really is. 2008, published in this medical journal, the literature, movement disorders. They showed that people with the lowest LDL cholesterol were at increased risk for Parkinson's by how much? 350%. Neurodegenerative disorders literally have a direct connection to a lack of cholesterol. So your nervous system needs cholesterol, your brain needs cholesterol, and every cell in your body needs cholesterol. You got to give the body what it needs. So we need omega-3 fats to rebuild what? All cell membranes, reduce inflammation, which is all brain problems, and balance your blood sugar. So how many of you guys want happy moods, clear focus, and a sharp memory? We all do. So if you're not taking these omega-3 fats, it's a really good idea that you do. You also want to make sure you get an abundance of these good fats. In fact, my recommendation is that about 60% of your diet is good, healthy fats in terms of the total number of calories. For those of you guys who are on the Nutrimos program, when you're done and we reset your metabolism, we should tell you to shoot for 1,800, 2,000 calories a day. Some of you guys 2,500 calories a day. You're like, oh my gosh, there's no way I could do that. You can with fats, because fats have more calories per kilogram than protein and carbs. And those fat calories give you the most amount of fuel that you could possibly ever need for your brain and for your body. 60% of the dry weight of your brain is made up of what? Fat. You got to give it what it needs. A super abundance of good healthy fats, the nuts, the avocados, extra virgin olive oil, flaxseed, fatty fish like salmon, sardines, grass-fed meats. The grain-fed, the commercial grain-fed, not the greatest thing, but grass-fed meats have good fat in them. Even the commercial grain-fed meat, even though it's got the highest omega-6 ratios, and it does have more an inflammatory effect in your body, 50% of the fat, of that fat in the T-bone steak is the equivalent of extra virgin olive oil. So most people don't know that. So, we need to have all these good fats in there. Coconut oil. How many of you guys use coconut oil? Oh, good. All right. How many of you guys use butter? Yeah, good. All right, again, you guys, listen, the more butter you use, the more coconut oil you use, if you're not using it, you start getting that in, that's going to trigger fat burning in your body. Your body starts using that as a primary source of fuel. and it really processes it differently. Super abundant energy, and you really go into fat burning with that stuff. One of the things I do every day is put butter in my coffee. Yeah, has anybody tried that since you heard? What kind of face is that, Anthony? She should have just thrown a knife out. Okay, let's rewind the tape here. Watch. How many of you guys like latte? What? A latte. You know, like with the foamy milk on top? Okay. So if you take coffee and you put it in the blender, and then you put like a little thing of butter in there with it, you know, a little good-sized chunk, put it in there, and you whip it up, it comes out the same as a latte. Except it's not just dairy that's going to do nothing. It's butter, which is going to burn fat. And the butter has arachidonic acid in it, which is something that helps you regrow new brain cells. Brain-derived neurotrophic factor, which helps you grow new brain cells. Neurogenesis.
He's still trying to grow them.
I'm going to have more butter in my coffee. So these are the type of things, like when I throw this out at a workshop, write it down, man. Take it home. These are gems. If it sounds crazy, try it anyway. You may like it, and you may like what it does for your body and your brain while you're at it.
I did coconut oil.
Coconut oil. You can put coconut oil in your coffee too. Yeah.
Why didn't you talk about olive oil
Raw butter.
rather than coconut?
Raw butter is, you know, when you know it's farmed by a dairy where they're not feeding the cows.
What?
Yeah, exactly. No antibiotics and all that stuff. So
No, you can heat up olive oil.
you don't want to heat up olive oil too high because then you turn it rancid. You want to keep the olive oil on low heat,
Yeah.
and that's good. That's good. All right. Typically speaking, generally you want to stick to what we're describing here generally as a paleo diet. And what the paleo diet suggests is, like I always talk about, proteins, fruits, and vegetables. Proteins, fruits, and vegetables. So you got your fish, you got your wild meats, your nuts. So you can have chicken, meat, you know, whatever proteins. Of course, the best is the wild. Then you have a good variety of nuts. Eggs are one of the best brain foods that you could eat. Pound for pound, dollar for dollar. Eggs are one of the most healthy brain foods that you could have. We don't eat enough eggs because we've been told they're high in what? Cholesterol. You know, which is the most important part. So you should be enjoying that. Low sugar fruits, vegetables. So nowhere in the paleo diet do you see, you know, the greens, the bread, the sugars. Again, you know, I thought grain was healthy. Most people have heard grain is healthy. It's got these vitamins and minerals and things. But again, show me a grain today that's not genetically modified and engineered. It's not the same grain as it was before. And, you know, from a perspective of how our bodies do best, historically, that's always been best for humankind. This stuff is really more of an agricultural phenomenon over the last century or two. And that's what's caused us to develop much of the diseases that we're dealing with right now.
What about sprouted bread?
Sprouted bread. Again, it's if you're mixing in their flour or stone grain or stone milled or all those things. If you're mixing all that in there, whole wheat flour, all those things, it's still grain. Yeah.
What kind of nuts are good for you, and why isn't beans good?
These are not part of the paleo diet, generally speaking. Now, I'm not saying beans are not good for you, but yeah, I mean, if you wanted to add them in, yeah, but it's not part of the paleo diet. You'll feel significantly different when you eat like this, and then you add beans in. You're going to start to have the expansion. You're going to feel different. Your body processes it differently.
I always thought beans were good, especially black beans. And brown beans were good.
They're all good. Yeah, they're all
But they're
good.
not.
So these are my best recommendations, guys. So again, you know, you can mix and put up whatever. Like, hey, you know, do I do some cheese every once in a while? Yeah, but make sure it's raw. But for the most part, this was the easiest thing that I could do to make this as easy as for you. Okay, look at the screen, take a picture. That's all you got. Okay, that's all you're gonna get. Okay, proteins, fruits, and vegetables. What is it, guys? Proteins, fruits, and vegetables. That's it. Okay. So we want to stick with that. And yeah. What's below the soda? That's cubes of sugar. Yeah, that's it. Yep. All right, music in the brain. Is music good for the brain? Yes. How many of you guys feel good when you listen to your favorite songs, favorite tunes? What do you think's happening there? Little serotonin? Okay. So, this is why it's important, you know, as children play musical instruments and dancing and things like that, it integrates every sensory part of the brain. And it exercises it. Your brain is a muscle. And when you're not involved with these types of things, those muscles lay dormant. And they do, you know, when they do MRIs, they do find that, you know, people have different sized brains. And the people who use their brains more in these areas, they have bigger brains. Matter of fact, the MRIs on people who had high carbohydrate diets had smaller brains, had shrinking of the brains. You did not know that. So, music is very important. Here's another recommendation. Yeah, how about that? Lack of sleep causes brain damage. Most sources recommend 7 to 8 hours a night. Okay, so you may or may not need that. I'll tell you, you have to figure out what's right for you. I know when I exercise, I need closer to 8. If I don't exercise, I'm good with like 6.5, closer to 7. Everybody's different. Maybe your body's fighting something off. Maybe you're symptomatic. Maybe your body's under attack from the immune system. Everybody's different, but generally speaking. But you want to have uninterrupted sleep. At least 5 to 6 hours of uninterrupted. So that's why, guys, you know, it's a good idea to void your bladder before you go to sleep. Don't drink past like 5, 6 o'clock. I don't really drink much past 4 or 5 o'clock in the afternoon. I don't like to be bothered. I don't want to get up in the middle of the night and make a trip to the bathroom. So be conscious of all these things, because this is what it amounts to. Cold and dark environment. Dark, cave-like, cool environment. Optimal, studies have shown optimal temperature 72 degrees. Dark, pull the shades down. You should not have any light. And it interferes with your biorhythms and your hormones if you do. Continue learning and growing. When you stop learning, you stop what? When you stop growing, you start what? Dying. That's why we say keep coming to the workshops. Grab your workshop card so you won't know when the next one is. Read our emails. How many of you guys read our emails that we send out to you? Whoa! If you are not getting the emails, please tell them up front so that you get those. Every week you should be getting an email that we send out to you with updates and all types of information like in the workshop. Weekly newsletters we pass out at the front desk. So these are all resources, and of course we have the website. And all that stuff is on the website also. So amazing resources at your fingertips. And the most important type of exercise for the brain is what? Aerobic exercise. So I could tell you this, that I want to mention this. Research shows that older adults that engage in consistent exercise, what's that word? Consistent. What does consistent mean? More than once annually? You will, thank you, Donna. You will reduce your risk of developing age-related dementia because you're oxygenating the brain. You're oxygenating your brain as a muscle. You need that. So, Jeffrey, can you stand up back there for a second? Everybody turn around and say hello to Jeffrey. Okay. Jeffrey's the manager of YouFit. It's a fitness center, and he's got coupons there. It's a no excuse deal. If you don't have a place to exercise or work out, I think he said $10. $10 a month is the membership. That is excuse free. I can't, like, if I didn't have a gym, that is a no-brainer, exactly. So please see Jeff back there at the end. He's got the coupons. He can get you connected and tell you about the facility and, you know, get you applying some of this stuff right here.
Would you call that the Humana Silver Citizens? Yes. Silver Citizens?
Sneakers. Silver sneakers.
Silver sneakers? Is that like that?
I'm not sure what it is. I don't know. I really don't. No, I'm not sure. Okay. So anti-inflammatory recommendations. Mariva. Some of you guys have had issues, pain in your knees, your hips, joints, and I've recommended this. There's more literature backing this as an anti-inflammatory than most of the pain medications that are prescription. It inhibits the proliferation of tumor cells. It's an anti-metastatic. It stops the spreading of cancer cells. It is helps your body destroy mutated cancer cells. But again, it's an anti-inflammatory, which is very useful in terms of application regarding what we're talking about right now tonight. It helps with heart disease if you have blood pressure, cholesterol, blood sugar. Helps with all that stuff. And that's the one thing that's in your supplement suite tonight. The other thing that I'm going to recommend is a probiotic. How many of you guys take a probiotic? I take one every day, and let me explain to you why it's so important. It's linked to depression, and it has a lot to do with brain function. Your gut, which is your intestines, is referred to as your second brain. And it actually produces more serotonin than your brain does. And so if you don't have that, if you have anything interrupting that, like celiac disease or gluten intolerance or inflammation in your colon, or you take antibiotics or you don't take a probiotic, you may not be absorbing the necessary elements that you need. Zinc, tryptophan, B vitamins, these are all necessary things that you need to make serotonin. So the vast majority of your feel-good hormones come from what? Come from what? Your intestines. That's where most of the serotonin is. So how important is intestinal health? You know that 80% of your immune system comes from your intestine. Now they're showing 80% of your serotonin comes from that as well. So that's why you need to be on a probiotic. Whether you took antibiotics or not, everybody needs to be on one of these for intestinal health. It helps with normal movement of your bowels. It helps with your immune system. It helps keep you from getting sick, chronic colds, prevents cancer. You know, just another one of those things. 1998 study determined about a third of those with celiac disease have depression. Amazing, isn't it? So this particular blend by Thorne, again, has the most absorbability. A lot of the supplements that you get at GNC are immediately destroyed by the stomach acid. This particular capsule has a resistance to that, and of course it's got everything that you need for good gut health. So DHA, just talking about that, how important it is, it's just the research here to support it. 485 individuals whose average age was 70 and who had mild memory problems were given a supplement containing DHA or a placebo for 6 months. And in their study, they found that people with memory complaints who took the DHA capsules for 6 months had almost double the reduction in errors on a test that measures learning and memory performance versus those who took the placebo. Okay? The benefits were roughly the equivalent to having the learning and memory skills of someone 3 years younger. So that's profound, guys. That's black and white research there. So again, this is part of our supplement suite tonight for obvious reasons. For brain function, it helps fight depression. Good for your blood sugar, your blood pressure, triglycerides, cancer prevention. Good for your skin, anti-inflammatory, and a number of other things. So that's our supplement suite, guys. Now, the reason why we do this is because everyone comes here for information, but what's more important than information is application. Right. Information without application is hallucination. Okay, so and so what we do is, to make it a little more palatable, we give you a big discount. It's 20% off if you buy all three together. They're synergistic, which means that Thorne has all the nutraceutical doctors at Thorne have literally crafted these and put them together for the application of what we're talking about tonight. So it's 20% off. There's a handful of packages, and for those of you guys who want them today. Now, if there's anything else that you would like to have, to get, any of the other Thorne supplements, I believe we discount 10%. As you guys know, if you've been here before, the only time we discount supplements are where? At the workshop. We want to incentivize you guys, we want to reward you and encourage you for taking care of yourself. So you can do that as soon as we're done. The other thing I want to ask you is, would everybody agree that you learned something important tonight? Yeah. Quite possibly life-changing. Yeah, some of you guys have some good decisions to make when you go home and look in the mirror tonight, and that's fine. I can help you with that. Again, whatever I can do to support you. But I will tell you this. There's people out there waiting for the answers that you guys got tonight. They're literally waiting for people to show up, for someone to show up and tell them the truth. And for lots of people, it's life and death. And what I would ask you to do out of the goodness of your hearts, just to be a force for good in this community, if you'd be willing to write a review about our office, about the workshops. You go online, go to Google, go to RateMDs. We gave you that in your handout. If you could just take 2 minutes and do that, the people who go and read reviews, which is like everyone today, you know, so if you do that and that's the first thing that they read, they're encouraged, they're more likely to take a step to do something good for their health and their life. I just want to encourage you to do that. If you do that, show us you did it, you get a 25% discount off of anything, any product, any supplement when you bring that in. So just take that home, you'll have that, and we would love to have you do that for you. So action steps as you leave tonight, don't forget to go over and see Joe for your massage, get your resources up front, see Jeffrey for the memberships there, the $10 memberships, and make sure you get registered. We're dialing your calendar for next month's workshop. That's it. Thank you so much for coming, guys. I love and appreciate you. God bless.
I love the coffee.
I needed to hear it. Give me a... Yeah.